Good. So what happens is that let us start with a simple question that most people will say that why should I be at all researcher? And this is particularly pertinent in many developing countries. In fact, in Indian Journal of Gastroenterology, recently we published a paper. You should all go through that paper. This paper is Biomedical Research in Developing Countries, Opportunities, Methods, and Challenges. So this is in Indian Journal of Gastroenterology. I think it is a free full text article, Biomedical Research in Developing Countries, Opportunities, Methods, and Challenges. So many people will say, if I am a medical practitioner, why should I do research at all? This will be the first question in many people's mind. Now let me tell you why you should do research. Some people will say, I like it. Like if you ask me, why do you do research? I'll say, I like it. I enjoy it. Now the second group of people will say, I have an inquiring mind. I want to pursue the truth. This will be the second kind of people. Third kind of people would be perfectionist. They will say, what is written in the book may not be the truth. What is written in the book may not be the truth. And I want to show those people who have written this book or written this article that they are wrong. So they are trying to be perfectionist. So that is another way. Fourth group of people will say, I'm ambitious. I want to be like a top guy in the world. That means I want to be a key opinion leader in the field in which I work in the world. So they typically, if they are successful, they make lasting contribution to the society. Because we all know many people left us, but because they worked extensively, published extensively, we remember them, we cite them. So they may be those who are ambitious. And lastly, to some people, it is the livelihood requirement. Like, let us say, if somebody is an academician working in an academic institution, if you do not have research grant, then you cannot do good work because research grant is very, very important. Second is some group of people, particularly in the many developed countries, they are paid additional salary from their research project. So that becomes livelihood requirement. Nowadays, Medical Council of India wants that you should publish, because if a certain number of publications are not produced by you, then you may not be promoted. So this become livelihood requirement. I think those people who are very idealistic, they will fall in the first three categories maybe. But many of us who may not be so idealistic, at least for our livelihood requirement, we will need to do medical research. Let us come to the research type. These are the two broad categories. One is basic research and other is clinical research. I'll not focus a lot on basic research because I know many of the people who are listening to me may be clinical researcher. So I'll go to the clinical research more than to the basic research. Now, let me tell you, some people, they come up, some institute come up, and very quickly these institute become famous. On the other hand, there are a group of institutions, they are serving the society for long, long time, but they actually do not make that mark. So this is important. Every institute wants to rise. So how to rise? Look at this important quote from NIH. It says, institute with a tradition of excellence has amply demonstrated, institutes with a tradition of excellence have amply demonstrated that research enhances the vitality of teaching. Teaching lifts the standard of care, and patient care opens up new avenues for research. Now, this is very, very important. If somebody wants to be a good teacher, he has to be, unfortunately, a researcher. If you want high quality patient care in your institution, you really need to be a researcher, because without research, actually, your institute does not develop, your department does not develop, and that's why they are integrated with each other. So now, when we come to research, let me tell you, when we come to research, the true method of discovery is like the flight. In the flight, it typically that it takes off from the runway. From the ground, it takes off. How does it take off? It takes off from an observation. You might have seen that a group of people do well, another group don't do well. For example, let us say you initially, when COVID-19 epidemic came, somebody might have observed that diabetic with COVID-19, they are not doing as well as non-diabetic people. This is a very, very simple observation that he has made. Now, from this observation, the flight goes to a thin air of imaginative generalization, because he might have seen 5 patients of diabetes mellitus, 5 were non-diabetic, and he found of the 5 diabetic mellitus, more number of patients died than those who were non-diabetic. Now he develops an imaginative generalization that I suspect diabetic don't do so well. Now then what happens is, now he has to again, like a flight has to land again onto the earth. Similarly, he has to land to a aim of the research. So we are going to talk about aim of the research or research question today. So the research question arises from simple observation. This observation may be on a small number of patients that you have seen. You have made an imaginative generalization from those few observations, and now you are landing to a focused research question which can lead to a big discovery in the future. So now when you talk about research question, you will ask me, how do I ask a research question? Once you have asked a research question, then we'll talk about in next session how to design a study. Then we'll talk about how to implement the study, how to analyze the data, how to write the paper. So we'll try to cover all these in 12 sessions. Now, what is a research question? The research question means uncertainty about something in the population that the investigator wants to resolve by making measurement on his study subject. So here you have tremendous uncertainty. You saw 5 diabetic patients, and these diabetic patients, let us say 2 of them died. You saw 5 people who are non-diabetic, none of them died. Now this is actually, it is too uncertain to say from this small observation that actually diabetic die more often due to COVID-19. But now from this 5 of 10 patient observation, you have a lot of uncertainty. Now you want to resolve this uncertainty by making measurement on a group of patients, obviously much bigger. You calculate the sample size and then you do the study. I'll talk about in the later session how to calculate the sample size. So now here, this is the research question. Research question is uncertainty about something in the population that the investigator wants to resolve by making measurement on his study subject. So the steps of the research question is choose a broad topic initially. Like in this particular example, we chose a very broad topic. COVID-19 pandemic came in. Somebody who is a researcher thought that those who are diabetic are dying more often than those who are non-diabetic. So he wanted to work in diabetes and COVID-19. So this is step one. Choose a broad topic initially. Then what happens is do some preliminary reading. This is very, very important. Because let us say you want to study that do the diabetic people die more often than non-diabetic? Maybe there are 2 papers, 3 papers, 4 papers, which has already actually resolved this issue and they found diabetic die more often. So you want to do that study now. Actually, it is not a great idea because it has been published until unless you find in those studies there were too many limitations. If there were too many limitations, here the research question will be to resolve this limitation. Now, therefore, it is important to do some preliminary reading. So once you have done some preliminary reading, you know that the imaginative generalization that came in your mind is this imaginative generalization is no more imaginative, but this has already been resolved by X, Y, Z. So this is very important to do some preliminary reading, literature search, like you use PubMed, you use Scopus, you use Embase, you use Google Scholar, as many search engine you want, you use those. Read carefully. See that you are not going to work on an idea which is already a beaten path. People have already worked on that idea and actually they have resolved this issue. And India, typically in India, we find people try to reproduce the studies which have already been done. Not a great idea. You should think about doing something for the first time. And I tell you that in spite of whatever we know, doing research in India is easier, I believe so, than in many developed countries. So therefore, do some preliminary reading, find out whether this issue has been solved already or not. Now then, based on your knowledge that you acquired, by the preliminary reading, you narrow down to a specific niche. Let us say, if I had this imaginative generalization that diabetic people may die more often. Now I do a literature search and I find that a lot of people have worked on this. There are at least 5 papers, and the 5 papers have already showed that diabetics have higher probability of death due to COVID-19 than non-diabetic. Then I will keep myself within this broad area. But now I'll say that though diabetics are known to die more often, the mechanism why they die is not known. The mechanism why they die is not known. So that means you are still within this broad area, but you are now doing a mechanistic study. Let us say you do a literature search and you find that mechanism has also been resolved. Now you may say, I want to target those mechanisms. And then by manipulating those mechanisms, by exploiting the knowledge of those mechanisms, I want to prevent death among diabetics. So that means you are not going away from that broad idea. Your broad idea is diabetes and COVID-19. But you are keeping within this broad idea and narrowing down to a specific niche. Now then, step 4 is focus to a specific research idea. Now you focus. That now we know we wanted to work on diabetes and COVID-19. Why do they die more? That was the first thing. Second, we did a lot of reading and we found this is already resolved. Diabetic die more often. Now I had a question in my mind that maybe the mechanism is not known, but still I did a lot of literature search and I found mechanism is known. So then let us say I want to prevent that. Does control of diabetes during COVID-19 reduces the mortality due to COVID-19 among diabetic compared to healthy control? So you are not going away from that broad area. So this is step 4. Now the step 5 is write the research question. This is very, very important. So any study that I do, typically I make a 1-page or 2-page write-up. I make a 1 or 2 pages write-up. So I typically in this write-up, I write a few lines which is background, why I am doing the study, why I am doing the study. I want to do a study for the first time in the world, though many a time you start it, somebody else have started, you may become the second, you may become the third, but no problem. It is all about how rapidly you can complete your study, how rapidly you can analyze your data, how rapidly you can write and have persuasion to submit in different journal to get published. So write the research project, and in the research project you must write your research question. So I am coming to research question now. So just if I recapitulate, I wanted to focus on a topic first, which is a broad area. I made it narrower by reading more and more, knowing what is not known and what is known in the literature. I now focused and made research question. So origin of a research question. How do I get this? All this that I told, how do you get this? So origin of research question may come from experience. Let us take an example. There was a fellow who is now in Bangladesh. His name is Professor Azad Khan. Professor Azad Khan was taking a fellowship or training in US. And what happened is, in those days, salazopyrin used to be treatment for ulcerative colitis. Salazopyrin used to be treatment for ulcerative colitis. Salazopyrin is a combination drug. It is a combination of 5-amino salicylic acid and sulfapyridine, which is a sulfur moiety. Now, salazopyrin is not free from side effects. Salazopyrin causes skin rash, salazopyrin causes bone marrow suppression, salazopyrin causes oligospermia, salazopyrin causes hair loss. So Professor Azad Khan thought that if salazopyrin is known to work in ulcerative colitis, that is already known. Its mechanism action was also known. It also has side effect that was known. And we all know sulfur has a lot of side effects. So he decided, is salazopyrin ability to improve ulcerative colitis related to sulfapyridine? Is it related to 5-amino salicylic acid? Is it related to this combination, that this combination works, the others will not work? So he did a randomized controlled trial where he compared sulfapyridine with 5-amino salicylic acid and salazopyrin. And what he found is very interesting. 5-amino salicylate is the active moiety which works in ulcerative colitis. Sulfapyridine gives only side effect. Since then, actually, we know that we write 5-amino salicylic acid alone. We don't write salazopyrin as a drug now for ulcerative colitis commonly. So that means the origin of research question come from previous research, previous work. This you get by your scholarship, your reading. If you are reading more, you are likely to get research question more often. Some people will say, I'm lazy, I don't want this because there are too much reading involved. If you get a good mentor who is in that field pioneer, it is like anybody who joins Professor Sarin will get a beautiful research topic and it will go to a good, it will get a good publication. So choice of mentor is very important. You should choose a mentor who publishes often, particularly in good journals. So this is how research question comes. Second is be alert to the new ideas wherever you go. Let us say there is a journal club going on in your department. Now, always sit with a pen and pencil, and if he says, this is not yet known in the literature, write it down. This is a new idea is given to you. Go to the national meeting, international meeting. In national international meeting, many a time people who are speaking are dedicated researchers in those fields. So therefore, if they say, this particular thing is not yet known, I got a new research idea. Skeptical attitude sometimes helps. Some people, they keep on asking questions. Even the established fact, they ask questions. These people usually get new research questions. Also, new technology will give you new research question. And today we know technology gap between developed country and developing countries such as India has become narrow. That means the technology which is available today in US is available tomorrow in India. So even in your department, let us say you got a new machine and the machine is very, very new. Now it is good to work on that machine because whatever you produce will be somewhat new. Observation on patient is very, very important. It is like if you observe something new in a group of patients, then you know that you work on that field. For example, let me give an example. How come salazopyrin works in the ulcerative colitis or Crohn's disease or IBD came? It is because salazopyrin used to be used in rheumatoid arthritis or joint problem, polyarthritis. And an observer found that when they gave salazopyrin to this patient, some of them had diarrhea. Their diarrhea also improved. And this led to the observation that salazopyrin not only works in the joint, but also works in the GI tract. So this is a simple observation on a group of patients. And if you teach, that is, knowledge is one thing, you give more, you enrich yourself. Teaching gives rise to new research question. Many a time you can get very skeptic type intelligent student who are very good scholars, and they will ask you such a good research question that it will be a very good area to work in the next 5 years to come. Now question is, keep the imagination roaming. Now let me tell you, this is what I tell myself. If you are a voracious reader, I tell you, not a great idea for research. If you are a reader, too much reading, you may not be always a good researcher. You know why? It is because if I got an imagination in my mind that this particular thing looks new to me, and if I keep on reading on that, it may be possible that I read too much, I delay execution of my idea. Second problem, when you read too much, you become jacketed. You become enclosed within the belief whatever the experts have in the world. Maybe whatever experts are thinking today in the world may not be the right approach. Maybe it is totally a wrong approach. Maybe your original research question will actually change the world. So therefore, excess reading is not a great idea in the research. Some people are born with a gifted brain. This is Isaac Newton. Isaac Newton actually was sitting below a tree and he found apple is falling from the tree. He was such an original thinking man that he thought, why should apple not go up but only fall down? And this is from where it is discovered gravity. This may not be the case with all of us. All of us are too simple, too average IQ. Therefore, let us consider scholarship, observation, mentor, and attending national meeting, attending international meeting are going to give us an original research question to work for. Now, let me tell you one thing. A good research question should be somewhat complex. If your research question is too simple, what is simple? If I can answer to a research question as yes or no, I know this research question can simply be published as a letter to editor, not as a full paper. Because if I have only a research question which can be answered by yes or no, means only categorical data and no continuous variable, not proven from multiple angles, then this is unlikely to be a good research question. So I told you all this. Now let me tell you, once you have written down your research question, this is very, very important. This is called colleague treatment. So you write down your research project. After writing down your research project, you choose some colleagues and you give to them. You say, this is the idea that I have. This is the research question that I have. And now, can you actually say what is wrong in it, what is right in it? Can you modify it? Now, only problem of colleague treatment is you should have good friendship among many researchers in the world, or you should have good people working in your team. Why it is important, I'll tell you. If you just give somebody for colleague treatment whom you can't trust, maybe your research idea will be stolen. So therefore, you should work collaboratively within the institute, within the department, within the country, or within the world. That should be a lasting collaboration, so that if you give for colleague treatment that particular research idea, the fellow will not steal that idea. Like typically what I do is that I have my own collaborators in many parts of the world. So what I do is, when I get a good research question, that is what I think as good, I actually give a WhatsApp phone call. And I say, I have a research question. What do you think about it? He says, okay, you can email me, I'll read and get back. And the good friends or good collaborators are those who actually don't say very good. They actually critique it and say it is very bad. You are not going to get a good sort of publication or good project out of it. So that means your colleagues should be trustworthy, but at the same time, they should be sharp enough to challenge the research question that you have developed. Now, these are the characteristics of research question. I just present to you this mnemonic. The mnemonic is FINER, FINER, FINER. What is FINER? F means feasible, feasible. Let us say I work in GI motility disorder, and I have a hypothesis that repeated childbirth can lead to fecal evacuation disorder among females. So this is my research question. Repeated childbirth can lead to fecal evacuation disorder in female. Now the problem is I can't work on this because it is not feasible to me. Why it is not feasible to me? It is not feasible to me because we do not have a very good or very active obstetric department in our institute. On the other hand, I can see Dr. Ajay Kumar sitting in KGMU. They have a very active obstetric department, so he can work on this. Is fecal evacuation disorder
हाँ
in females
बिल्कुल
who had multiple childbirth? So it should be feasible based on what is the cost of the project. Second is based on whether you have those patients or not. Let us say you want to work on a very hi-fi molecular technique. You want to analyze this data with artificial intelligence. You do not have expert of artificial intelligence on in this your institute. You do not have an active molecular biology department. Now, obviously, this is not feasible. So F is for feasible. FINER, F is feasible. Second is interesting. And interesting does not mean interesting to you. You know why? Because if I diagnose a patient for the first time in my life, this is an interesting patient to me. I write this as a case report and send to the journal. Journal immediately rejects it. You know why? Because it is interesting to you, but not interesting to the world, not interesting to the journal. Because this has been already published multiple times, either as a case report or case series or large scale studies. You are finding it interesting because you diagnose it for the first time. So interesting means interesting to the world, interesting to the journal, interesting to everybody. So that will come from colleague treatment. Now the interesting is very, very connected to novel. Novel means it should be something original. It is something very, very original, like Professor Ajad Khan did with salazopyrin and ulcerative colitis. Okay, so this is very, very original. Let us say one fellow, he actually for the first time described a viral pneumonia in Wuhan city. Obviously, this is original. This is novel. Okay, somebody first time said this viral pneumonia maybe came from animal, but this is transmitting from human to human. This is novel. This is original. Now you today from India do a study that it transmit from human to human. It is no more novel. So FINER, F for feasible, I for interesting, N for novel. It should be ethical, because you can't talk about something which is ethically not justified. You can't say that I will do lung biopsy, I'll do heart biopsy and study histopathology in a patient whom in these biopsies are not needed for the clinical care. So therefore it has to be ethical. And finally, it should be relevant. Relevant to whom? Relevant to peer reviewer, relevant to key opinion leader, relevant to your patient, relevant to policymaker, relevant to journal editor. So it should be relevant. So relevant is very, very connected to interesting and novel. Okay, so remember this final. Always put primary research question and secondary research question. Now, when you write a project, let me tell you, there should be only one or two primary research questions. If you have too many research questions, it is a poor project. So if you are a young guy trying to get funding like intramural funding or extramural funding, now remember one thing, 1 to 2 primary research question, 1 to 2 secondary research question. You will say, what do you want to place, which one do you want to place in primary? Let us say you have a mechanistic aim and you have a clinical aim. Clinical aim will be primary aim. You know why? Because to a funding agency, to a policymaker, to an institution, patients' life matter, disease cure matter. So therefore, they will be interested whether the drug actually cures the disease, controls the disease or not. They will not be interested so much that in a subset of patient you find the drug block NF-kappa B, and that is how it reduces lymphocyte trafficking. That is how it modifies immune response. That is how it works. This can't be the primary question. Primary question has to be clinical question, that it works or it doesn't work. The secondary question has to be mechanistic question. But no more than 2 primary question, no more than 2 primary secondary question. So this is already, I told you, good research question will be focused, it will be non-biased, it will be answerable, it will be relevant, it will be intriguing, and it will be pertinent. So here I say decide your research question. If it was an interactive session, I would like here if somebody can tell me a research question that he may be having in his mind. Dr. Ajay, can you tell me one research question? Or Dr. Avasthi, I can see Dr. Avasthi there, I can see Dr. Ajay there. So do you want to give me one research question?
Sir, I have chosen this research question, fecal evacuation disorder in multipara female.
Okay, very good.
Yes.
So that is already done. Think about something else. So did you identify the previous studies?
Okay, so I would like to have my research in the similar field, sir. Fecal evacuation disorder in person using tobacco.
Okay, but I think it is a little far-fetched.
Okay, sir.
So you see, tobacco, what relation would it have? So tobacco, what relation would it have? Biological relationship with fecal evacuation disorder. So this is where colic treatment is important. If at all it causes, let us say in 1% or 2% people, now your sample size will be too big. And did you do previous studies to see whether any study has tried to show that? Because fecal evacuation disorder is more common in female, whereas tobacco consumption is less common in female. So I have an opposite argument or counter argument to your research question. So I think it is not relevant. Sorry to be disappointing you.
I will have a further literature search. Then I will discuss with you later on, sir.
Very good. So this is where we stop and say decide your research question. Dr. Ajay tried to decide a research question. Identify previous studies. He said, I will now read the previous studies. Obviously, studies will be possible after obtaining material. Example, the quality and quantity of information available. Many a time, if you have good quality and quantity of material, I will do a meta-analysis there. So if I have done that much of work to see all the previous studies, obtain all the previous studies, I will do a meta-analysis, publish it, and refine my research question. So this is the path of the research question. Remember this another mnemonic, PICO. What is PICO? PICO is P for patient or population or problem. So when you ask a research question, remember FINER, remember PICO. In FINER, F for feasible, I for interesting, N for novel, E for ethical, R for relevant. In PICO, P for patient, population or problem. So which patient you are going to study, which population you are going to study, which problem you are going to study. Like Dr. Ajay said, is going to study patients who have fecal evacuation disorder. Okay, his problem is fecal evacuation disorder. Now he talked about an intervention. The intervention, though he did an observational study plan, but intervention is tobacco. Okay, so I for intervention, prognostic factor or exposure. Here it comes under exposure. Now obviously he will take a comparator or compare people with whom he will compare. So whom will you compare with? He will compare with people who do not take tobacco. And what is his outcome? Outcome is development of fecal evacuation disorder. So PICO, P stand for patient, population or problem, I stand for intervention, prognostic factor or exposure, C stand for comparison, and O stand for outcome which you want to measure. Let us say this is a PICO example. PICO here, in middle-aged male amputees suffering from phantom limb pain, is gabapentin compared with placebo effective in decreasing pain syndrome? So this is a PICO. So here the fellow wants to study middle-aged male patient who underwent amputation, now who are suffering from phantom pain. That means they don't have limb, still have the pain in the limb. Now he wants to study gabapentin compared with placebo, whether it decreases the pain. This is PICO, an example of PICO. So what is research? Research is to see what everybody else has seen, to think what nobody else has thought. So that means you are making a lot of observation in your clinical practice every day. But unfortunately, you are not thinking what nobody else has thought. And in fact, one of the problems that we have in our country or many developing countries, what happens is I was talking with Suresh Chari, who was originally an Indian, he is now an American, works in Mayo Rochester. Suresh asked me, what is your daily routine like? I gave him daily routine. And he said, how do you then publish? I said, why not? He said, where do you get time to think what nobody else has thought? Where is your time to think? Because you are saying from morning till night, you are only working. Where is the time to think? So that is what we need. We know we have challenges, but within these challenges, we have to manage. Let me take a few examples of research questions from a few of my studies. This is a study, esophageal acidification during nocturnal acid breakthrough with elaprazole versus omeprazole in gastroesophageal reflux disease. Look at my M, only 2 M. 1 M is frequency and degree of esophageal acidification during nocturnal acid breakthrough. M2 is frequency and severity of nocturnal acid breakthrough while on elaprazole, which is a long-acting PPI, and omeprazole, which is a short-acting PPI. Only 2 M's. Now, if you want, I can give background of this. See, what happens is that we treat patient of gastroesophageal reflux disease with proton pump inhibitor. Those who are listening are medical people. They know that gastroesophageal reflux disease means they have burning in the chest. They have heartburn. And this is because acid is coming from the stomach into the esophagus and burning the esophageal valve. Now, how to treat this patient? You treat this patient by giving an acid blocker. So acid secretion blocker. These are called proton pump inhibitor. Proton pump inhibitor. There is a fellow in US, his name is Donald Castell. Donald Castell found that when he was doing pH metry in patients of gastroesophageal reflux disease who are on treatment with proton pump inhibitor, what he found is that many a time his stomach acidity comes back. Though he's on drug, his stomach acidity comes back in night. Why does it come back? Why does it come back? You know, nature has created or nature has given acid in the stomach so that we can digest food. Acid is required for the digestion of food. So nature has given this acid so that we can digest food. So having acid is normal. Now we, the doctor, block the acid. We want to do something against nature. But the stomach wants to recover in the night when you give the drug in the morning. By night, your drug ability to suppress acid is gone. So in the night, stomach recovers to normal. Now, Donald Castell propagated a concept that he found that stomach acid comes back while on PPI. And he even suggested that you should give a nighttime H2 blocker like famotidine, ranitidine to block acid secretion. We challenge that concept. We said if stomach is bringing back the acid, actually that is normal, that is healthy. Why should I block that acid unless in the night time esophagus gets acidified? If esophagus also gets acidified when the stomach acid has come back, I want to block that acid. But if esophagus is not acidified in the night, I should not block that acid. And in this study, what we found is that many a time, though in the night, stomach becomes acidified, but esophagus does not get acidified. So we challenged that big man, Donald Castell, from our small lab, and we published at least 2 papers in good journal of impact factor of around 4, which are now widely cited. So this came from skeptic attitude. Skepticism is important. Let us look at this. This is a paper that we published. That was a paper that we published in American Journal of Gastroenterology, in the impact factor of which is 10. Now, what do we want to study? Look at the 3M. M1 is the frequency of continuing bowel dysfunction after acute gastroenteritis. M2 is predictor. What are the factors which predict that this fellow will have continuing abnormality of his GI tract, not the other fellow after having acute gastroenteritis? And there is a third M which is a little complex, I don't want to bring here. So see, we have only 3M. Truly speaking, our M1 and M2 were primary M and M3 was the secondary M. Now this is another, again look at the M, only 2 M, MA and MB. So MA was to study symptom resolution among IBS patient with or without a small intestinal bacterial overgrowth with norfloxacin treatment, and its efficacy in obtaining negative breath test result for bacterial overgrowth. Look at this, everything has 1 or 2 M, and the M's are very clearly written. So when you are writing an intramural project or extramural project, please write the M very, very clearly. And before you write the M clearly, you must give a background briefly to understand the reviewer, what is the novelty in this M. So that is all about. So just let me recapitulate. Research question is a very important question. This makes your study good or bad. It should be feasible and valid. Ingredient for developing a research question are scholarship, experience, mentor, and guide. Research question arises from article, journal club, conferences, observation, and teaching. Therefore, when you are attending the conferences, we should be most of the time attentively listening to the speaker. Characteristic of a good research question is finer. Remember this mnemonic. Study plan must be written in 1 to 2 pages. You should have enough number of colleagues who can critique that study plan, so that using an iterative process that is making it better and better, make a good research plan, make only one or two primary research question and one or two secondary research question. And this is the last quote. The future belongs to learner. For the learned find themselves too well equipped to deal with the world that has ceased to exist. So if you want to be a good researcher, you should keep on learning, even from your student. So future belongs to learner. So this is where I stop. And if you have any question, I'll love to answer. Thank you so much.